Cholesterol Guidelines. The guidelines on cholesterol for adults. Controlling blood cholesterol levels may decrease the risk of heart attack and stroke. The National Institute of Health, the American Heart Association and the American College of Cardiology publish guidelines to help physicians and patients with this risk reduction. The most recent consensus in 2004 recommended the following. The expected release date for the new guidelines is the summer of 2010. Major recommendations in the update include, high and very high risk people. For high risk patients, the overall goal remains an LDL level of less than 100 mg/dl. But for very high risk patients whose LDL levels are already below 100 mg/dl, there is also an option to use drug therapy to go below 70 mg/dl goal. High-risk people are those who have coronary heart disease or disease of the blood vessels to the brain or extremities, or diabetes, or multiple 2 or more risk factors, for example, smoking, hypertension, that give them the greater than 20% chance of having a heart attack within 10 years. Very high-risk people are those who have cardiovascular disease together with either multiple risk factors, especially diabetes, or severe and poorly controlled risk factors such as continued smoking or metabolic syndrome. A constellation of risk factors associated with obesity including high triglycerides and low HDL. Patients hospitalized for acute coronary syndromes such as heart attack are also at very high risk. Moderately high-risk people. For moderately high-risk patients, the goal remains an LDL under 130 mg/dl, but there is a therapeutic option to set a lower LDL goal of under 100 mg/dl and to use drug therapy at LDL levels of 100, 129 mg/dl to reach this lower goal. Moderately high-risk patients are those who have multiple 2 or more risk factors for coronary heart disease together with a 10 to 20% risk of heart attack within 10 years. For high-risk or moderately high-risk patients, the report advises that the intensity of LDL-lowering drug therapy be sufficient to achieve at least a 30 to 40% reduction in LDL levels. This can be accomplished by taking statins or by combining lower doses of statins with other drugs, bile acid resins, nicotinic acid, Niacin, niacin, SLO-niacin or ezetimibe, or with food products containing plant stanol/sterols. Lower/moderate risk people. The update did not revise recommendations for lower risk persons. Those with moderate risk 2 or more risk factors plus an under 10% risk of a heart attack in 10 years.